All right, moving on to the respiratory system. So, a couple different points to talk about here: tachypnea or tachypnea versus hyperventilation. Tachypnea is very fast breathing. Hyperventilation is over exchanging carbon dioxide and oxygen. They're not one and the same because someone could breathe very shallow, tachypnic, but they're not breathing far enough down into the lungs to exchange the oxygen and carbon dioxide. And so they would have a hypoventilation. Okay. Bradypnea, slow breathing. If it's super, super slow and deep, they could hyperventilate if it's really deep, but they also could hypoventilate. So it's something to keep in mind there. Kussmaul's breathing, this is typically seen with diabetic ketoacidosis. And Cheyenne-Stokes, this is typically damage to the brain, narcotic overdose. Okay, that's usually where you're going to see those differences. So for here, you guys can work through this, but look at the breathing rate. Normal is typically 12 to 20, 12 to 18, depending on what textbook you look at. And then look at PCO2. He's on the low end, right? But he's still in range. So he's tachypnic, okay? Would this cause acidosis? More likely is an alkalosis. He's breathing out all that CO2 and hydrogen ion. Okay? Coughing, there's mechanical receptors, there's chemoreceptors. Really, cough comes from brain. Cough medicines don't work. Okay, they're really a gimmick. Raw honey can work because it has Botox in it, has botulinum toxin in it, so it can paralyze it. But in reality, you have to use narcotics to suppress up here to suppress the cough. So this is where you see like the cough medications with codeine in them. That's why they exist. Okay? Unfortunately, they've been abused. So, here in Georgia, I think is actually where they created lean or purple drink, whatever, purple drink. I know things. And so they were abusing, that's promethazine with codeine. They were abusing it. And so now a lot of people don't want to prescribe it. And even if they do prescribe it, sometimes it's hard to fill. The pharmacies don't get it anymore because of that abuse. Okay? So here, a couple other points. Acute respiratory failure, so it's when we drop below these values. Hypoxemia, that's when we drop below this oxygen saturation. And when this happens over time, there's this phenomena that happens in the fingers called clubbing. Okay, they fatten up, and so we can see that. You can see here like the bluing in the fingers. Okay? That's probably Raynaud's happening there. VQ mismatch. So there is at the top of your lungs there is more oxygen than blood, and so there's this higher ratio. Okay, more ventilation than blood. On the base, it's the reverse. There is less oxygen to blood ratio, okay? And that's normal. The problem is when we start to alter these guys. So, a couple different situations here. So, here's normal VQ. Low VQ means low ventilation. So, here's impaired ventilation. That's alveolus collapsed. So, deoxygenated blood is coming through, not getting oxygenated, returning to the bloodstream. Okay? A shunt is nothing. Nothing is passing through. This is a completely collapsed alveolus. And so we have very low VQ. High VQ, there is like an embolus in here. Okay? It's blocking the blood flow, and this becomes alveolar dead space. There's air in there, but we can't exchange it because there's no blood passing by it. All right, chest wall disorders. So just so we're familiar, you have the pleura out here, the parietal pleura, and then you have visceral pleura touching the lungs. Between the two is pleural space. This is sealed. It has to be sealed. That's what allows us to draw in air. When the diaphragm contracts, it moves down, it takes with it parietal pleura, and as it does, it creates negative pressure in that pleural space, which is like a vacuum, and it just suctions the visceral pleura with it, which is attached to the lungs, pulling the lungs open. Because atmospheric air is now higher than what's inside of you, air flows in. When you relax the diaphragm, you create more atmospheric or more pressure inside your lungs than atmospheric pressure. Air is exhaled. Okay? If we break this, the lung will collapse. That's what ends up happening. Other causations of chest wall restriction. This is an intense scoliosis. You can see with kyphosis where they're bent over, like elderly, that can do it as well. The lungs can't inflate properly because the rib cage is all contorted on this patient. Okay? Flail chest, this is when you break ribs, complete fracture of the free-floating ribs, okay, the ones that are not attached to the sternum. And what happens is when they breathe, okay, when they inhale, it suctions in. When they exhale, it pushes out. So that needs to be surgically corrected. Okay? Typically, that's like blunt force trauma. Okay? Pneumothorax, this is a collapse of lung. Air is in the pleural space. So here's this lung collapse down. That's it. Right? The problem here is when patients get stabbed, for example, and you pull it out. That's not good. In this patient, this was probably a bleb. So what happens is it's just a random rupture of an alveolus, and that's how air is getting in there. They heal. It just spontaneously happens. It's not anything they did. It's just genetic. Okay? But if they get stabbed, or like in this guy, broken ribs, and it's stabbed and punctured, the problem here is there's an external wound. Air, it creates a flap. Air comes in when they inhale. When they exhale, the flap closes and it pressurizes. Next time they inhale, same thing. And it pressurizes. And it forces the lung to collapse. Look at the trachea moved way over. Okay? Look at the diaphragm pushed down. Look at the heart shifted over. Eventually, the other lung will collapse as well. So this is why, like, if someone gets stabbed, you don't pull it out. You don't want to do that. Okay? Leave it in, get them to the hospital. So in this situation, they'll stick a tube in and relieve that pressure so the lung can reinflate. All right, pleural effusions. There's all kinds of things that can be in here. So there's a couple that we'll look at. But, so like transidate, this is just fluid being pushed in there. Okay, so it's typically clear, right? Watery like. Exudate, this is where cells are in there, and it can be any type of cell. It can be infection, it can be blood. It just depends on the situation. So respiratory volumes, total exchange, vital capacity, that's how much air you can truly move in, breathing as deep as you can, and then breathing out as much as you can. Okay, FEV1, that should be about 80% volume of air can be pushed from super deep breath, pushed out in 1 second. Okay, so obstructive and restrictive diseases. Obstructive is air can't move through. Resistance, think the wall. Okay, so resistance is increased compliance. Increased compliance in obstructive. So that's like your COPD. Restrictive is decreased compliance. So this is like a fibrosis. The lungs don't want to expand. They just push the air out real quick. Okay? Scoliosis would probably fall under a restrictive because the lungs can't expand, right? That's severe scoliosis that can't expand. Pulmonary fibrosis. So typically here, medication, amiodarone is a big cause. Just pulmonary disease, but usually it's idiopathic. We don't know why. Okay, and it's very bad. Okay. So what you're looking at here, these are alveoli, and that's normal. And then over here, this is all just destroyed fibrotic tissue. Pneumoconiosis. So this is coal miner's lung. So it's due to debris getting in there, macrophages consuming it, building up. One of my favorites is an F1 like race team. I believe it was McLaren. They were using molybdenum, like a metal in their pistons because they're like super light. Well, I think it was Ferrari found out and didn't like that they were beating them, and so they ratted them out, and they used this as the point as why they can't run that in their motors, because it was being spit out into the air and it was going to cause pneumoconiosis in people, and so they had to change their motor because of that. I find that hilarious. Okay. Pulmonary edema. So it could be heart related or not heart related. It can just happen sometimes. It could be blood pressure. But you can see all this like speckling in here. That's the edema. Okay. And you can see that chest looks big also. All right. Acute respiratory distress syndrome, ARDS. You probably heard this thrown around a bit with COVID. And that ground glass appearance, that's any viral pneumonia can trigger this. Okay? And any bacterial pneumonia can trigger this. It wasn't unique to COVID. But the problem here, the lungs are not functioning properly. It can even be idiopathic. Okay? And then aspiration of gastric contents. So this is it going down in there and damaging the lungs directly. Same with overdose. The reason overdose is they're losing gag reflex. Right? So things migrate down. Asthma is an obstructive disease, and so a couple issues here. There's swelling of the airways, so that obstructs. They produce more mucus, that obstructs, and then just tightening down of the terminal bronchioles right before the alveoli. There's smooth muscle there, and it contracts. Why? We don't know. Okay, like why do we have that? We don't know. There's theories like why that muscle exists, but truly we don't know the reason for it. And so this is where we give medications to open it up, reduce the secretions, all of that. Okay? Chronic obstructive disease. So this is COPD over time. I mean, this is really asthma right here. And that's what I was talking about, that terminal bronchiole, and there's that contraction and mucus plug building up, and air is trapped, can't go out. That's the obstruction. Chronic bronchitis, so this you have to have over a 2-year period, 3 months at a time, and it's this inflammation, once again, overproduction of mucus, coughing up, sputum, that kind of stuff. Emphysema, so this is dilation of the airways, so the alveoli get super huge, how big the lungs look. That's emphysema, usually linked with smoking. And here you can see how translucent the lungs are. Look how the heart is standing up because the lungs are pushing it and shifting it, and then they're pointing out a bleb here that could rupture at any point in time. Lung compliance, so this is that give, that's that stretch, okay? And then recoil is the contraction. So we need both. We need compliance to be able to pull in the proper amount of air, and then we need recoil or elasticity to contract it to help push the air out. When you affect one of these, you start to have lung issues, okay? Infections. Lobar pneumonia, so this is just one little lobe, and then bronchopneumonia would be entire lung. So you can see here it's fully infected. Okay? This is both sides. One of the most common lung infections, TB. Completely treatable. We don't vaccinate for it here in the U.S., but if you travel abroad a lot, Certain countries are higher risk. They may recommend it. The reason we don't vaccinate here, it's a live vaccine, so you run the risk of contracting TB. And TB comes here all the time. There's cases, and my wife's had numerous cases over the years. Okay? I had in clinicals, a family was adopting a child, and so part of the adoption process here in Georgia, they have to be TB tested, vaccinated, all this stuff. And the husband ended up testing positive for TB. And the only thing we could figure out was they had traveled to Puerto Rico at some point. We're like, maybe you picked it up there. We don't know. Destroys the lungs and eventually can migrate into the bloodstream, and it's just the straight killer at that point. So that's TB infection, and that's the Gone complex right there. That's what they're imaging. And what that is calcified macrophages around it trying to wall it off. Sinusitis, so the sinuses help make our skull lighter and also for sound production. And so when there's an infection, it occludes it. So it usually can come from some type of, you had an upper respiratory infection, a cold, something like that. It builds up in there. Allergies can trigger it, or poor dental hygiene. It can migrate up into there. Pulmonary emboli. So the Westmark sign, that's that like dent right there that you can see. There's all kinds. I mean, this one was probably a killer. And by probably, I'm telling you it is because it's been pulled out of a body. But that's probably like a saddle embolus. The way it's shaped, that's probably what that is. So it sat right on the pulmonary arteries where they split to go into the lungs. Cancer, there's all kinds. Bronchiogenic carcinoma is the most common. Small cell adenocarcinoma, these become difficult. Small cell is one of the worst to deal with. I mean, you can see it all right here, and then it's just diffuse in here. There's a bunch. Smoking is the number one causation, but it's not the only causation. Secondhand smoke, definitely a causation. Genetic, all kinds of things can trigger it. It's interesting. Back in the day, the unfiltered cigarettes would create this large cell carcinoma. Way more common. Had tons of it, but it was more easily treatable. When they put the filters on there, because it's smaller particles making it through, it's more on the periphery of the lung, and it's that small cell carcinoma, and it's more aggressive. Less cancers, but more aggressive. So, kind of interesting. Metastasis can come from anywhere. So here in this one, they call it cannonball lung. And you can see all the splotches in there. That's just metastatic cancer. In this one, it was renal cell carcinoma that triggered it. Mesothelioma. So this is of the parietal pleura. It's a tumor growing on there, and it starts to constrict the lungs, damage the lungs, and eventually metastasizes if not treated. And lastly, cystic fibrosis. So we're back on this guy. If you can't pump in chloride ions, you build up mucus. If you build up mucus, the airways are obstructed. Okay? They are at high risk of infections, Pseudomonas aeruginosa, which is like in water. It's pretty much everywhere. It's in stool. It's everywhere. And then the increased risk of pneumothorax, and then because the pancreas is also affected, there's your type 1 diabetes, malabsorption because they can't get enzymes out to break down the food.